Welcome back. Air pollution is associated with chronic health problems in children, like bronchitis and asthma. In Southern California, air pollution levels have been decreasing over the past 20 years. A new study examined whether those reductions have helped to improve respiratory symptoms in the state's children.
This health tip is brought to you by
Desert View Hospital and Mountain Valley Physicians Group. Don't put your health on hold. We have time for you. Call us to schedule your appointment. 775-751-7100.
Planes, trains, and automobiles are ever present in Southern California. They all contribute to what's called ambient air pollution.
Ambient air pollution is particulate matter, which are microscopic particles. Some of them, especially the fine ones, actually deposit deep into the lung and are known to cause a lot of respiratory problems in children and humans in general.
Dr. Chiara Sperani from the University of Southern California and co-authors followed just over 4,600 children in 8 Southern California communities across 3 different time periods, from 1993 to 2012. In addition to monitoring air quality, the researchers looked at children with and without asthma and whether they reported respiratory symptoms like bronchitis, congestion, phlegm production, or a daily cough for 3 months in a row during the previous year.
In the children with asthma, we found at the beginning of the study, in the first cohort, almost 48% of them had bronchitic symptoms in the last year. Now, in the children without asthma, this number was only about 11%.
Air pollution levels dropped significantly during the observation period. Bronchitic symptoms were compared in 3 groups of children from 1993 to 2012.
The prevalence of bronchitic symptoms went down by about 32% in those children with asthma. We also found that it went down by about 21% in those children without asthma. These reductions were significant and important in both children with asthma and children without asthma. So all children benefited from these reductions in air pollution. Protecting our environment really leads to better respiratory health in children.
Catherine Dolf, The JAMA Report.
Dr. Perhane says the findings from Southern California can help guide air quality efforts in other locations in the United States and around the world. Well, thousands of residents in Texas are having a difficult day today. More than a foot of rain in some places flooded low-lying areas across the Houston region today, forcing officials to suspend bus and rail services, closing schools and government offices, and are urging residents to stay home amid what authorities say were extremely dangerous conditions. At least 2 people have died in the floods. The driver of an 18-wheeler that drove into high waters was later found dead inside the cab, and another man was found dead inside a submerged car. Crews performed 1,200 high water rescues as of this afternoon. At least 1,000 homes were flooded in Harris County, some people trapped in their homes or attics. 9 hospitals have been closed because of flooding and 3 apartment buildings evacuated. A series of classes are happening soon at NyE Communities Coalition.
It is the first telemedicine workshop. Stanford is interested in doing a pilot to see if this type of telemedicine workshop would work.
What is telemedicine?
We're going to broadcast it between Tonopah and Pahrump.
And so what is the subject?
Diabetes self-management.
And this is all part of NyE Communities Coalition, is that right?
Stanford has allowed NyE Communities Coalition to offer the pilot to our population.
It's open to the public?
Yes, it's no cost. And it's a 6-week workshop. It'll run Fridays from 1:30 to 3.
And so this is all going to be on diabetes. Who's going to be teaching it?
Me.
Oh yeah.
For this part, for this section, and then we'll have another teacher in Tonopah, so that we'll be a team, and we probably will have somebody taking notes.
What type of people are going to want to attend this workshop?
Pre-diabetic, diabetics, and caretakers of those that have diabetes.
And so this is something that definitely you need to become a part of. The classes, like you said, are 6 weeks. Should you attend the whole entire 6 weeks?
Absolutely. There's very important information on stress management, medication management, all sorts of things to help you to treat the symptoms of diabetes. People who've taken the class have been better with their doctors, they communicate better with the doctors, and they see their doctors less.
Is there any other classes that are coming up in this type of series?
We do have chronic disease. We have one running now. There should be another one developing right after. We're not sure exactly where it's going to be held, and there may be a specific focus.
Should people register ahead of time?
It's in development. For this one, they can register for the diabetes class with Diane at NyE Communities Coalition and 727-9970.
All right. And any more information about this class?
I would just suggest to take advantage of it. It's a no-cost workshop right now. We have the funding for it, so we want to keep it in the community. So we need to get people in those classes.
The more people we have in the classes, the more likelihood they're going to continue.
Date and time again?
Friday, May 13th from 1:30 to 3.
And then 6 weeks after that every Friday?
Every Friday from 1:30 to 3 for 6 weeks.
And the number once again?
775-727-9970, Diana.
We'll tell you about what's going on with Yucca Mountain after this break.